Now this is also called Graves' disease, so we call it Gaines' disease, high and hyper energy. Now on the other side, for hypothyroidism, we think low and slow energy. So start moving your thighs during the exam. For hyper, we have high energy, and for hypo, we have just this low and slow. All right, guys, now a little bit of pathophysiology that the NCLEX expects you guys to know. But let's be honest, the NCLEX is never going to ask you a direct question about pathophysiology. So as you know, just like all endocrine hormones, it's a big game of telephone, or dominoes if you will. So the hypothalamus releases TRH, which then tells the anterior pituitary to release TSH, the thyroid stimulating hormone. And can you guess what the thyroid stimulating hormone does? Well, yes, guys, it stimulates the thyroid. Oh, how stimulating. So once stimulated, the thyroid pops out three most important key players, our T3 and T4, which are basically our active thyroid hormones, and also calcitonin, which basically puts a ton of calcium into the bone. So our memory trick is it tones down the calcium in the blood by putting a ton of calcium into the bone. So calcitonin, a ton in the bone. Now our thyroid hormones T3 and T4 are the main focus for our thyroid conditions. Hypo, we have low T3 and T4, and hyper, we have high T3 and T4. And to make this, your body needs dietary iodine found in salt. So iodine deficiency is a major cause of that hypo-low thyroidism in developing countries. So what causes our high T3 and T4 in hyperthyroidism? The number one cause is our autoimmune disease we've talked about, Graves' disease. We think Gaines' disease in high thyroid. But also too much iodine means too much thyroid hormone. And even treating hypothyroid conditions, guys, if we give those patients too much thyroid meds, like levothyroxine, which leaves too much thyroid hormones in the body, we can eventually cause a hyper condition. Balancing these two conditions is kind of like a teeter-totter, or basically like a seesaw. Hyper will be the exact opposite than hypo. So low T3 and T4 in our hypo comes from that autoimmune disease, guys, called Hashimoto's, that low and slow thyroid. Now, other causes are low iodine in the diet. And a big one, guys, big test tip here, pituitary tumors. And even anti-thyroid treatments like a thyroidectomy, where we take out that thyroid gland and now the body can't produce any thyroid hormones at all. Now, as far as diagnostic tests, don't let the NCLEX trick you here. So here's a tip. Always focus on T3 and T4 first. Don't even look at TSH initially. If T3 and T4 are high, then it's hyperthy. And guys, if it's low, then it's hypo. Now, you don't have to memorize any of the values. The NCLEX will give you the ranges. Okay, now after seeing T3 and T4, then we look at TSH. So TSH will always be the opposite of T3 and T4 here. TSH is just trying to slow the hyper and amp up the hypo. As far as signs and symptoms, it's super simple. Everything in hyper will be high and hot, and everything in hypo is going to be the exact opposite, guys, low and slow. So for hyperthyroid, that Graves' disease, our Gaines' disease, everything is super high. We're going to be bouncing off the walls, super amped up, like you're on a bunch of energy drinks. And again, the priority is to monitor for this thyroid storm, aka thyroid toxicosis. This will kill the patient. Again, NCLEX key terms are agitation, confusion, and even restlessness. Those are usually the first signs. Coupled with extremely high temperatures over 105, high heart rate, and blood pressure. Now, classic signs that will show up on select all apply questions, guys, we use our two G's for Graves' disease. So the first G is for grape eyes. Now the NCLEX term is exophthalmos. These are big eyeballs that are popping out like big grapes. So think exo and exophthalmos as eyes exiting the body. So typically we use an eye patch or even tape down the eyelid for sleeping, guys. That's always on the NCLEX. I know it's super weird, but always an NCLEX term. And our second G is for golf balls in the throat, called a goiter. This will look like a big bullfrog looking throat. And now everything else will be high. So we'll have high blood pressure, aka hypertension. Remember, over 140, the heart says overloading. We'll also see high heart rate, known as tachycardia, over 100. Heart palpitations. We'll even see atrial fibrillation. Now we'll also see high weight loss. And guys, the NCLEX will try and trick you here. No, we're not talking about weight gain. The biggest thing is weight loss. So we'll see skinny patients. Since we have high energy burn, we burn a lot of high calories. Now with that, we'll have high hot temperature. Hot and sweaty skin, known as diaphoresis. Not dry skin, sweaty skin. Now this is also called heat intolerance. You will definitely see this on SATA NCLEX questions. And the very last thing, we have a high GI, so we get diarrhea, not constipation. Patients in hyper mode need a hyper diet with high calories, also high protein and carbohydrates. Now, big key word here, frequent meals and snacks, like 6 to 8 per day. Huge NCLEX key term. And guys, we also do the 3 big no-nos for the NCLEX. No high fiber, we need low fiber, unless the patient's constipated. Also, no caffeine, so no coffees, sodas, or teas. And lastly, no spicy food. Okay, now on the other side, in our hypo or Hashimoto's, everything is low and slow. So super depressed, fat, and lethargic. So we get the exact opposite from hyper. Again, the extreme priority is the extreme low and slow, airway, breathing, and circulation. Now the key term is myxedema coma, guys, extremely low respiratory rate. So we think respiratory failure. Again, the priority is intubation supplies at the bedside. NCLEX keyword here is endotracheal intubation set or tracheostomy setup. So we're expecting extremely low BP, aka hypotension, extremely low heart rate, known as bradycardia, below 60, and even low temperature called cold intolerance. Now the NCLEX tip here is no electric blanket. This can actually harm the patient if they're not closely monitored. Now 2 more NCLEX tips, which are the biggest risks for myxedema coma. Usually after a thyroid removal, like a thyroidectomy, or abruptly stopping thyroid replacement hormones like levothyroxine. Usually those 2 lead to the myxedema coma, the extreme low and slow. Now classic signs for our hypothyroidism. Guys, everything's going to be low and slow. Now these will show up on SATA select all the flight questions. Just think everything's going to be low and slow. We have low energy, known as fatigue, weakness, muscle pains, and aches. Low metabolism, meaning we have weight gain and water gain. There will be edema in the legs and even under the eyes. Now the big key word here is not weight loss. We have low energy, which means low calories burned. So guys, we have weight gain here. We also have low digestion, called constipation, not diarrhea. Low hair, or basically hair loss, called alopecia. Now guys, this is not hirsutism. Huge NCLEX tip, they're gonna try and trick you. Hirsutism is that hairy suit. We have hair loss here. We also have low mental status, or basically forgetfulness. Low mood, known as depression, apathy, or confusion. Low libido with low sex drive or infertile. And also slow, dry skin turgor. Huge NCLEX tip here, guys. Not hot, not sweaty. Hypo, we have that dry skin. Now our last 2 NCLEX keywords for low and slow. This is what's called irregular menstruation, guys. So we have no periods, or basically a missed period. So for a no period, it's called amenorrhea. So just think amen, no period. Now for low but heavy periods, we call it hypermenorrhea. So just think hypermenstruation, heavy bleeding. Now for diet and hypo, guys, we have low energy. So we need low calories, low cholesterol, low saturated fats. And since we have low energy, we need frequent rest periods. Huge NCLEX tip right there. The most common NCLEX questions revolve around priority, or basically who dies first. And it's always the extreme conditions. For example, you will get a question about a client in Hashimoto's with that low heart rate, less than 60, or those low respirations, about 10, right? So we're thinking here, myxedema coma, guys. We put that intubation tray or the endotracheal setup near the bedside. So on the other side of things, you get a question about a client in Graves' disease, guys, with high heart rate, like over 100 beats per minute, or high blood pressure over 140 systolic and high temperature, like over 101. It's the biggest thing. Think thyroid storm, and the priority here is to monitor for agitation and confusion. Now, pharmacology and surgeries, always NCLEX favorites here, guys. Your notes, grab your study guides that we provide. We're going to be covering only the highly tested NCLEX topics here. So meds for hypothyroidism. So we only have one main drug that you need to know for the NCLEX and for your nursing exam. It's called levothyroxine, which leaves T3 and T4 in the body. Think levo we give for hypothyroidism. Now our second memory trick for those SATA questions is just the acronym LEVO. L for lifelong drug. We never stop taking this drug. These are what's known as forever medications. And L for long, slow onset. Usually 3 to 4 weeks till we find relief. Now test questions love to ask patient education on these 2 points, so I'd write those down. E is for early morning and empty stomach. Always 30 to 60 minutes before breakfast. 1 time a day at the same time every day. Never at night. Levo is always in the morning when you levantate, or basically get up. Now V is for very hyper, guys. We report signs and symptoms of hyperthyroidism. Basically high heart rate, high BP, high temperature. It could lead to an extreme condition known as our thyroid storm. So keywords we're looking for are agitation and confusion, usually the early signs of a thyroid storm. And lastly, O is for, oh, the baby's fine. So guys, it's pregnancy safe. Now the 4 most tested no-nos to help drive home the point, for the most tested points here, guys. No food. We take an hour before breakfast. Keyword here is empty stomach. No cure. This medication is a hormone replacement. It will never cure. It'll only treat. So yes, this is a forever drug. And no double dosing. If you ever miss a dose, take ASAP or as soon as possible. And lastly, never abruptly stop taking medication. Keyword is abrupt stop. It can lead to an extreme low condition with low respiratory rate, low BP, and guys, that will kill your patient. Again, this is called myxedema coma. Now, some common NCLEX questions that will try and trick you guys. It's going to give you SATA questions. For example, additional patient teaching is needed when the patient on levo says it doesn't work after 18 days. Teach it's a slow onset, 3 to 4 weeks, like 21 days. Now the patient 30 weeks pregnant, is that okay? Yes, it's baby safe. And my personal favorite, patient states, I'm glad this med will finally cure me. Guys, no, there's no cure here. And a little side note for hypo, since everything is low and slow. We avoid narcotics, or basically opioids, like Vicodin and other painkillers. And guys, we avoid benzos, which are sedatives. These drugs can actually add to the low and slow, dropping us into low condition, that myxedema coma. Okay, so now the pharmacology for hyperthyroidism, that Graves' disease or Gaines' disease. Think here, the thyroid is super amped up and super high. So we need to slow down that thyroid, right? Or basically we need to kill it. So the 4 drugs you need to know. Methimazole is not baby safe, but its friend PTU, propethyluracil. Memory trick for PTU is put the thyroid underground. This guy is baby safe, but we report fever and sore throat. These dudes stop the thyroid from making T3 and T4. Basically slow it down. Now SSKI, or potassium iodide. The memory trick is SSK. S for shrinks the thyroid before thyroid removal, or basically thyroidectomy. This is done to reduce the bleeding, aka reduce the vascularity. S is for stains the teeth. So guys, drink it through a straw with some juice. And K is to keep it 1 hour apart from other anti-thyroid medications. Lastly, since hyperthyroid, we have a hyperheart, we use beta blockers, which puts the brakes on the heart, slowing it down. Now these guys end in LOL, like propanolol. So think the double L's in LOL lowers the double heart vitals, so low blood pressure and low heart rate. Now next up, guys, the most dangerous and consequently the most tested here. RAIU, radioactive iodine uptake, guys. These are the big guns. It destroys the thyroid in like 1 dose. So we expect hypo, low signs signs and symptoms. Basically, we're monitoring for extreme lows like respiratory failure. Now again, very toxic, making the patient like radioactive. So some common NCLEX selected apply questions always come from this section. Guys, write these down. Before giving, we always ensure a pregnancy test is negative. We always remove neck jewelry and dentures. That one came up a lot in the NCLEX here. And 5 to 7 days before giving this drug, we hold any anti-thyroid meds. And guys, yes, you're awake. There's no anesthesia. There's no conscious sedation. So we're just NPO 2 to 4 hours before and 1 to 2 hours after, guys. Not 12 hours. This is not surgery. This is just a radioactive pill. One dose, one and done. Lasts about 24 to 72 hours. And speaking of after we give it, we avoid everyone up to 7 days. Now, most quiz banks say about 1 to 3 days. So just avoid everyone. So no going around pregnant people, no crowds, not even the same restroom. We're flushing it 3 times. Not even the same food utensils. And no, not the same laundry as your family. Separate laundry baskets. And lastly, no cuddling and not even kissing. Now lastly, guys, if all else fails, we can do a good old-fashioned surgery known as a thyroidectomy. Now a lot of NCLEX tips come from this section, so please write this down. Since thyroidectomy are usually done for hyperthyroidism, it's kind of like removing a big glass of milk. Surgeons can accidentally squeeze out a lot of thyroid hormones into the body. So guys, we're monitoring for high extreme conditions after surgery, known as a thyroid storm. Okay, now for the big NCLEX priorities, we have the ABCs of thyroidectomy. A is for airway. Since surgery is done near the neck, guys, we think airway. Huge NCLEX key terms here, write these down. Laryngeal stridor, noisy breathing, and even hoarseness or weak voice. Huge, big NCLEX key terms there. These usually indicate an airway problem, so the number one priority is endotracheal tube at bedside. Now the NCLEX will call it different things like intubation supplies and even tracheostomy setup. So anything with the word trach in it, guys, keep it at the bedside. Huge on the NCLEX. Now B is for breathing that is noisy like covered before. Laryngeal stridor, we always monitor voice strength and quality. Now next, C is for circulation. Obviously we just had the surgery, so guys, we're looking for bleeding, but specifically bleeding around the pillow and insertion site. Now big NCLEX key terms for positioning to prevent the bleeding, guys, write these down. We want a neutral head and neck alignment. This means not supine, big no. Head of the bed, 30 to 45 degrees, aka semi-pallid. Big no for flexing. So no flex zone for sure. No extending the neck, huge and always on the NCLEX. Now our last C, which is another NCLEX favorite, calcium that is low, below 8.6, known as hypocalcemia. Now guys, these numbers are based on NCLEX standards, so your textbook and your school might differ. So memory trick is if you remove the T, then you check the C. Or basically, if you remove the thyroid, then guys, check the calcium. Now the first sign of low calcium, write this down, tingling and numbness or circumoral tingling around the mouth and even the fingers. And the two other keywords are T and C for low calcium. So Trousseau's, which is basically that arm twerk with the blood pressure cuff on, and Chavostics, that cheeky smile with facial numbness. So I call these the two dance moves of low calcium. So remember, if you remove the T, then check the C. Alright guys, that wraps it up for hyper and hypo